Today's webinar is titled The CAPCE Accreditation Process from Application to Approval, presented by Robert Wales and Jay Scott. I'm going to pass it over now to our presenters. Thank you both so much for being here with us today to share your knowledge and experience with us, and we look forward to the presentation.
Rio, thank you very much, and thank you to the National Association of EMS Educators for having us today. We're very excited to be here, and we always look forward to opportunities to share information about CAPCE, about the accreditation process, and what we do and what we hope to do in the future here at CAPCE. With me today is Mr. Robert Wales, the chairman of the CAPCE Board of Directors, and in just a minute we'll talk about the makeup of the rest of the Board of Directors. We've also scheduled a fair amount of time at the end of the presentation for questions and answers. So we hope the timing works out well, and then we'll be able to answer as many questions as we possibly can. Our objectives today, by the time this session is done, you'll be able to list all the CAPCE accreditation standards, discuss the CAPCE accreditation application process, and then detail the CAPCE review process and the review time that it takes us to go through the review process. So I'm going to give you a brief history. First, I want to talk about the staff of CAPCE. I'm the executive director. Susan Walter is the assistant executive director. Maria Garcia is the accreditation manager. Nicole Camarillo is the data coordinator. Aubrey Barnes is the marketing manager. Marcus Hall is the database manager. We have a compliance officer whose identity is kind of kept secret. He's our secret shopper, and we have a number of staff members that review applications for us. The officers of the organization, Mr. Wales is the chair, Dr. Joe Hawley is the vice chair, and Mark Terry, formerly of the National Registry of EMTs, is the secretary treasurer. Our board members, and it's important to note that each one of the EMS leadership organizations appoints a liaison, and that liaison sits on the board of directors. So our board of directors literally is made up of individuals that have been appointed by the major organizations within the nation, including Dr. March, who's the NAEMSP liaison, Ron Lawler from NAEMSE that you probably all know, Braxton Morrison from the National Registry, Bruce Barnhart from the American Red Cross, Joe House from NASEMSO, Jerry Wheatley from NAEMT, Graham Pierce from IBSC, David Keith from the American Heart Association, and the American College of Emergency Physicians liaison position is currently open, but I understand they're working to get that position filled. So I'm going to talk to you about a brief history of the organization, and then after the history, Mr. Wales is going to talk about the standards for accreditation, and then I'm going to come back in and talk about the application process. So back in 1992, the then president of NAEMT, Janet Head, felt that there really wasn't much standardization amongst EMS continuing education, and there really wasn't much policing of the process. So she worked with other people, including Bill Brown of the National Registry, and others, to bring together representatives from the major EMS organizations to form a board of directors. That's how the liaison process started. And these are the organizations listed here that were the original organizations that started the then CSBEAM's board of directors. And since then, we've added the American Heart Association, the American Red Cross, and then the NASEMSO state directors and training officials are now one. So there's one representative from NASEMSO. You probably remember this logo from CSBEAM's, the Continuing Education Coordinating Board for Emergency Medical Services. And I think that there are a couple things that the board considered about the name. First, the name really didn't describe what CAPCE does. It didn't describe the mission. We're the Commission on Accreditation for Pre-Hospital Continuing Education. So it was important that our name matched the mission of the organization. So back in 2016, we rebranded the organization and renamed the organization so the name matched the mission and the goals of now CAPCE. And I'm going to turn it over to Mr. Wales to talk about some of our standards.
Thank you, Jay. And before I get started, I'll give a quick introduction of myself. I got my start as an EMT in South Carolina 22 years ago. So I have maintained a National Registry certification since then. I've been a paramedic since 2005. I worked in South Carolina, Pickens County and Greenville County, South Carolina as a paramedic and a training officer until 2010 when I joined the American Heart Association. I worked there for 12 years in various education and instructional design roles. And now I work for Medtronic, building educational programs for our heart valve programs here. When I started working for the AHA, I went to my first ever National Association of EMS Educators conference. And at that conference, I was introduced to CAPCE, the organization then, where I became a reviewer. And a few years later, in 2013, joined the board. So I really have always enjoyed the NEMC conferences, the classes, and the workshops that they do. And that also provided me with the opportunity to be introduced to CAPCE, now CAPCE, and to the role that I have here today. So Jay talked a little bit about the founding of CAPCE and how the need for standardization across the board was so important in the early 90s and continues to be today. So when you look at all of the standards that we have, all of the policies, they all relate back to the singular idea of standardization. That doesn't mean that every instructor and every organization has to offer exactly the same content and exactly the same educational experience, but we want everyone to have a process in place that makes sure that their quality of output in their educational program for continuing education is a high quality output that is driving better patient care in the long run. I think we all know that when we're fresh out of EMT school or fresh out of paramedic school, we are not 100% ready to handle everything that comes at us. That is not the end of our educational experience. Continuing education is the path that takes us from that basic competency level of a newly certified person to being a productive and well-qualified paramedic or EMT. So I'm going to go through a bunch of these standards, and we'll try to relate all of them back to that idea of finding standardization, finding a way to help our educational providers build good processes that help them to have good educational programs. So here you'll see a bunch of categories that we're going to get into. We're going to talk about item writing, how to write a good test. We're going to talk about how to assign continuing education hours, physician oversight and medical direction, learning objectives. I think hopefully everyone, if you're at the point in your educational journey where you are an educator developing content, you know how to write learning objectives. Then we're going to talk about references, what kind of programs are eligible for a CAPCE accreditation, how do we collect data, how do we report data, and what does it look like to get a site visit from CAPCE. Next slide, please.
Okay. Yeah.
There we go. So first we'll talk about program oversight. Every organization that is accredited by CAPCE to offer accredited continuing education has to have oversight of their programs. Leadership is obviously going to be key in making sure that the processes in place within that organization work and are continually improved. So the foundation of that is going to be the program committee. We require that every accredited provider have a program committee of at least 3 people. One of them has to be a physician, and the rest should be made up of people with different backgrounds that complement each other in order to create high-quality education programs. Often these programs will have very senior medics with lots of experience, senior educators. Sometimes you'll have people with other specialties like lawyers, instructional designers, or other administrators. We don't really dictate exactly what that makeup should be, but we do ask in the application process that the applicant give us resumes for each of the members of the program committee so that we can take a look at their background and experience and make sure that it pairs up well with what this organization is trying to do. We work with a broad range of organizations. Some of them are very deep into healthcare. Some of them look more at psychological well-being of providers. Others look at scene safety and evidence preservation. So there's a broad range of expertise that needs to be on that program committee, and each accredited provider has to look at the courses that they offer to identify what kind of expertise they need on their committee. Every organization needs to have a physician medical director, and this is typically going to be someone with extensive emergency experience or EMS experience. There have been a few situations where we have started looking at organizations that are offering continuing education that are not related to direct patient care, more looking at, for example, the psychological well-being of providers, mental resilience, where that physician's expertise may come from a different area, but that's still a new area of exploration for us. Right now, we do still require all programs to have a physician medical director. And then we look at instructor qualifications. Obviously, if we have instructors who are not qualified, then we're not going to have the output that we want. It's important to note that as we look at these programs and as we look at the application, we don't look at every single educational output. We don't review every single educational program that these organizations do. We look at what is the process behind building that, and then we like to see some examples of how those programs are built in some samples of that education to compare whether or not it followed that process. Next slide, please. So requirements for accredited providers, they need to be an eligible organization. They need to be have offered continuing education for a year. They need to have be a recognized organization with a letter of support from their CEO and their state EMS office. So organizations typically will get a start offering education through their state, and then after a year history of that, they can apply for CAPCE accreditation. The organizations also need to have a dedicated accreditation manager who is our point of contact for all things related to CAPCE and accreditation with the accredited provider, as we want to make sure that we have a very strong open line of communication should any issues arise. Next slide, please. All right. As you are developing an educational program, hopefully you are familiar with the process of writing good learning objectives, of making sure that the content is relevant to the providers that you are teaching, that it's well referenced with up-to-date references. We have had a few courses that we reviewed over time where the most recent reference was from the 90s. And while there still are a lot of practices from the 90s that we use today, there have been many changes, many updates, and a lot more published research that we should be referencing. So we want to make sure that all of our references are at least as close as possible to within the last few years to make sure that we are using the most updated medical guidelines and practices. So as we start with those objectives, we build out the course, we build that relevant content, we have supporting references to document it, and then we test all of that with appropriate item writing. If any of you have had the opportunity to go to an item writing workshop with the National Registry, you know that there is a lot of work and detail that goes into developing good test questions. And it's not something that is intuitive, that we naturally understand as we become educators. It's a skill that needs to be practiced. So we have published guidelines for item writing. We like to stay away from questions that are true-false answers, because whether you know the question or not, you have a 50-50 chance of getting it right. And there is a tendency for educators to attempt to make those questions more difficult by just adding in some complication or making it a trick question that's not really accurately assessing whether the student understands the content. We also like to stay away from questions like none of the above or all of the above, because those have been shown to more accurately test how well the student takes a test, as opposed to how well the student understands the educational content that they were presented with. There are full item writing guidelines on our website under our accreditation manual. If you'd like to take a look at the rest of those, I just gave you a few examples of those. But we feel that in order to accurately evaluate your educational program, you have to have effective items that have been written with the content in mind, with the learning objectives in mind. Next slide, please. Taking one step back, before we even write our learning objectives, we require that accredited providers do a needs assessment before creating any new educational content. And often this is, I think, one of the categories that people get most confused about what is a needs assessment? Do we have to conduct this massive research project? And a needs assessment is really based on what your educational institution is and what you're trying to accomplish. This could be something as simple as if you are an in-house continuing education provider, you have an EMS service that you're the training officer for, you may simply be referencing the national standard requirements for your providers to recertify. That can be a needs assessment. You could be looking at QA or QI data to say, okay, we're really good on STEMI identification, treatment, and destination selection, but we really don't do as well with strokes and TIAs. So we need to do some more education on that. There's a broad range of data and data gathering practices that you can use to identify the need for an educational activity. It could also be a survey of providers in your area. If you're not connected to an EMS service that's providing patient care, you don't have access to that data, you may do an online survey and say, what is the area that you feel the weakest in? Or what is an area of continuing education that you struggle to find every couple of years? That could serve as an appropriate needs assessment. But we'd like to see organizations and program committees specifically going through the practice of identifying why there is a need for this program, because identifying why there is a need helps to guide what your learning objectives are, and your learning objectives guide everything else that you do in developing an educational activity. So without an effective needs assessment, you're not going to be able to continue on and develop a program that solves that problem. Curriculum matching, typically your curriculum is going to have your learning objectives, your teaching content and activities, and some sort of testing mechanism at the end. And those things all need to match. Your learning objectives come first, then you build the content to match those learning objectives, and then you build that testing mechanism, the items that you're writing to assess whether or not you were able to meet those learning objectives. And then finally, educational data is collected, used for reporting to CAPCE and or your state office. You should use it for quality improvement of your programs and further program development. So speaking of, we'll talk about program development in just a minute, but we can move on to the next slide now. All right, so standards continuing to talk about data reporting. Jay will get into a little bit of the nuance of reporting later, but educational providers who are accredited by CAPCE will report their accreditation, their accredited educational completions to us in a timely manner so that it goes to our database, and then that information goes from our database to the National Registry when the individual practitioner is ready to recertify. We have a specific format for that data to be reported, and there's a couple different options for providers to deliver that information to us. For delivery of the education program, there are a wide number of options. We have, typically our providers are going to offer either F1 or F3 training. F1 is our in-person training. That's what you would typically think of as classroom education. F3 is distributive learning, which is your non-interactive e-learning. Anytime that you can log into a course at any time, everyone who takes that course gets the same educational experience, and you can finish that course without interacting with anybody. That's an F3 course. Also very popular is the virtual instructor-led training course, which is an F5. And that course is where you have a live instructor, you have an interaction, possibly on a Zoom like this call, where you're chatting back with the instructor in the chat box or you're talking to them, but there's a live interaction virtually. That's F5 or virtual instructor-led training. F2, going back to F2 is kind of your out-of-the-box courses like BLS, ACLS, PALS, PHTLS. Pretty much anything that has a really common acronym that ends in LS in the EMS world, that's going to fall under your F2 classification. It's a repeatable course. It's always the same content done over and over again. And then finally, our newest designation is F4, which is adaptive learning. So this would be an e-learning course that you would go into, but as you go in and answer questions and interact with the course, it may take you through a different learning pathway than the next person who goes in and takes it. So everyone has an individualized program where the software asks questions to probe the knowledge of the learner to see what they know, and then builds a pathway for them to do that. So there's a couple programs that have met the qualifications for F4 and are offering those adaptive learning programs. Evaluation. The evaluation step comprises of two parts. One is your post-tests, your learning evaluation. Did the student learn what they needed to? But then also a course feedback form of some sort to gather information from the students about their perception of the learning experience, whether it met their needs, whether it was free from commercial bias, and whether or not the training lived up to their expectations. And then finally, through that data reporting process, how do we issue credits for training? Do we issue the correct amount? And we have policies in place to give guidance to our providers to make sure that people are getting the right amount of training. Learners shouldn't be able to log into a system, do 15 minutes of training, and get an hour or 2 hours of credit. They should be engaged in the training during the time of training, and the amount of time should be fairly consistent with the amount of credit that they're getting. And there's more specifics on that in our policy manual. Next slide, please. A couple other things that have popped up over the years is getting express consent for images, especially if you're using images in an educational program that are from actual patient care scenarios, images or videos or any other media. We want to make sure that there has been consent given for those images to be used in an educational program. Plagiarism, obviously, this comes into play quite often. We've seen entire educational programs be lifted from another provider, rebranded, and given back to us. And our eagle eye reviewers and our secret shopper have found that. And we had one program that applied for accreditation that had completely lifted everything they had from another provider and were passing it off as their own content. In addition to being potentially illegal, very dishonest, and against our standards, it's also just demonstration of someone's either inability or unwillingness to put in the work to create a good program. And that's not the type of organization that we accredit and like to work with. And then there needs to be some specific disclosures to students about how their data will be used and who it will be disclosed to. We have a massive database of tens of millions of course completions from students over the years. And we are very careful to make sure that we honor the trust that these learners put in us of managing that data. And we're very careful to only share that with organizations like the National Registry in the States that are, for one, that the students are giving their authorization to use, and also are not going to use it for any commercial gain. So we put a lot of work into making sure that we protect the data of all the students who are taking CAPCE accredited courses. Next slide, please. And finally, we have two new policies that we've worked on just over the last year that are very timely and relevant. First is our AI policy. We've seen a few providers starting to use artificial intelligence to create and design educational programs. And there's nothing inherently wrong with that. AI has a number of good uses, and I just used it a few weeks ago to write my performance objectives for the next fiscal year for my job, and it came out 90% effective. And I used most of the content that ChatGPT provided me, and had to go and finesse it a little bit to make it work. And that's kind of the idea that we're looking at with our AI policy, is that it's perfectly fine for an educational organization to use AI to help to generate some of their educational content. But they need to be transparent that they're using AI to do that. They are still responsible for making sure that all of the content is fair, that it's balanced, it's free from any sort of commercial bias, and that it's well documented. AI has not really been shown to do a great job of citing sources. So we have seen a few issues where providers have used it to create a program and ostensibly cite the sources from the programs, but the sources don't come back matched up well with the content that is used. So the burden is still on the accredited provider to have a robust review of that content, making sure that they have good references that is matched to the learning objectives in the material. And then we have an accreditation policy that just articulates a little bit more clearly that when someone applies for accreditation, there's essentially going to be three potential outcomes for that application. One is that they are accredited without contingencies. That is for an organization that has everything in line, everything in order, and matches up very well with our requirements. There are some that we will offer provisional accreditation for, where they can operate as an accredited provider while they fix a few things that may be outstanding. And then finally, the third bucket would be those that are denied accreditation. And we don't do this very often. It's usually reserved for organizations that just refuse to make changes in their practices or policies during that process. We've had some that have received feedback from our reviewers that their application did not meet the requirements, and they waited and resubmitted it with minimal to no changes. And we have a bunch of reviewers who are paid, and we have some who are volunteer, and it's just not a good use of resources for us to send the same things back to them over and over again. So for those, that's the only time that we really find ourselves denying accreditation, as opposed to being willing to work with these applicants to get their application to where it needs to be. So what do we look for in an application? For that part, I'm going to pass it back to Jay, and he will take over from there.
Thank you very much. So all this boils down to is what we're really looking for is a description of the educational infrastructure, from needs assessment to the program committee, with input from the medical director, then data from the needs assessment that then builds the educational agenda, that develops content in a way that's relevant for the practice of emergency medical services, that is delivered in a way that EMS clinicians have access to, that they can use, that they can work with, that they then can evaluate and they get credit for. So in an application, if you can show us the continuum really from needs assessment all the way through program committee to development, delivery, evaluation, and then credit, then typically you become accredited. And it's also very important to know that each of the standards for accreditation are listed in our accreditation manual. So if you go to the homepage for CAPCE, capce.org, on the top right-hand corner of the page, you'll see the 2023 accreditation manual. That will be the 25 accreditation manual as of January 1st. And every one of the sections of the accreditation manual lines up exactly with the sections of the online application. So the application is managed through the website. And I'll tell you about the specific steps of that here in just a minute. And I apologize for moving backwards with the slides, but the controls for Zoom are exactly opposite of the controls for the program that CAPCE uses. So if I go backwards, it's habit, and I apologize if I have to then skip forward again. So there are two basic types of applications, and the first one is that course by course accreditation process. And individuals or companies may say, I've only got one course that I want to apply for accreditation for. And some people even say, I want to apply for an individual course so I can get used to the application process. And then maybe once I'm used to the process and I get the flow of the application, then I might step up and apply for organizational accreditation. So the difference is the application for a course accreditation really just looks at the specifics of the course. What are the objectives? What's the content? What's the schedule? What's the evaluation form look like? Is there a conflict of interest form? And is there an evaluation tool? And does the user get a certificate? So we're really just looking at course specific things that everybody on this call should be pretty well familiar with at this point. Organizational accreditation really is a deeper dive into the educational infrastructure of an entire organization. And if you've gone through the organizational accreditation process, such as any EMSE has, and you get through the application process and you're approved, and any EMSE's most recent application last year, they were granted accreditation without contingencies. They did an amazing job with their application. But then anything that the accredited organization decides to do, any educational program they decide to offer, is considered accreditation under CAPCE. There is no need for applying for individual courses separately once you've achieved organizational accreditation. So there's some underlying confusion for some people. They think if they get organizational accreditation, if they've achieved it, then they have to go back through and reapply for every individual course. And it's not true. Organizational accreditation is that blanket statement that says your educational infrastructure is excellent and we trust that you can create and organize your own courses as long as they meet CAPCE standards. And then again, individual course accreditation, we call it a combined application because an individual course application is exactly the same as the application for a one-time event or a conference. And at one point in time, we had separate applications for those things. And we decided that from our end, it'd make more sense to make a combined application that covers all of those things. So one application for one-time events, individual courses or conferences, and a separate application for organizational accreditation. So what's the benefit then of organizational accreditation? Well, I think the first thing is it's a single application. And if you've gone through the accreditation manual, and if you're familiar with the sections of the manual, the sections of the application exactly mirror the sections of the manual. So you should be very familiar with the application and what the application wants in the process. So every application, once it's approved, is accredited for a 3-year accreditation cycle. And then the individual providers, such as any EMSE, get to log into their own account within the CAPCE dashboard, within the CAPCE website. They see their own dashboard. They can log in, they can create their own courses, they can create their own course numbers. They set the date, the time, the number of hours, advanced versus basic, and they assign a topic. So all of those things are managed by the organization, and then CAPCE has oversight into that process, and we make sure that all the courses continue to meet our standards. The accredited organization also has access to all the records. So all the records of the individual courses that they've done and the records of the providers. So as we've talked about just a couple minutes ago, that we require that accredited providers report all their course completions to the CAPCE database, which is currently 25 million records strong. And then individual accredited providers have ability to log into the CAPCE website to look at their own account, to download their own records, to make sure that all of the records that they have match the records that they've submitted to the CAPCE database. We also include them in the Find a Course process within our website. If you go to User Resources in the top menu of the website, you'll see the link for courses, and then under that courses, you can click on the link Find a Course, and basically the user, the individual, depending what course type they need to have to complete the recertification process, they type in the course topic that they want, and then the Find a Course lists every course under that topic for all of the accredited providers. So once you create a course and you insert that topic and that course becomes immediately available within the Find a Course application within the web page. And then also the logo of the organization. If you look at the CAPCE homepage, you'll see across the top there's a scrolling banner with the logos of all the accredited providers. And so once you become accredited, you get your logo attached to that banner. So people that log in get to scroll through and see which organization they would like to take courses from. Or if I need a level 1 instructor course, I can find that pretty easily by either clicking on the logo for NAEMSE in the banner or going to find a course, and they can type in level 1 instructor. And that course link with the dates and times of those courses should show up right away. So the application process, you go to our website, and on the very top right-hand side of the website, there's a little link for an application key. You click that link and you fill out a short survey, your name, your email address, your phone number, your organization name, and you hit submit. And we get that through an automated process. We see your request for a key, we create an account, and then the first part of organizational accreditation is we administer a $100 fee that kind of starts the process, and it covers our administrative cost should you start the application and then just not ever finish it. So you pay that the fee, we send you the application key after the fee is paid, and then you go through and you complete the application. So you get an automated message back that says, here's the link to the website, here's your application key. You copy that key, you open the link, you paste the key into the website, and your application starts. You go through the individual steps of the application that are managed right on our website, and I'll show you that in just a minute. And then once you're complete, you hit the complete button, and that goes to the review process. And then we invoice you for the balance of the application fee. So again, you use that key to log in to start the application. The application itself mirrors the sections in the accreditation manual. So in the accreditation manual, for example, the section on medical director asks for a description of your relationship with your physician, and we ask you for a copy of the CV of that person and for the description of that person's roles and responsibilities within your organization, and you submit that information directly into the website. So you fill out a brief narrative, and then any supporting documentation that's required for that individual section of the application gets submitted directly into the web page. We don't want a Dropbox and emails. Everything is managed directly through the website. At the end of the application, when it's done, you sign a couple attestation documents, and then you submit the application to us. Once the application is complete and you hit the submit button, that application is then assigned to an independent group of reviewers that review the application. So those reviewers, those 3 or 4 people, get to log in. They see the narrative. They see your supporting documents section by section. They get to complete their checklist and make their comments on the application directly on the website. So the page that you see is exactly mirrored underneath, and underneath that page are the checklist and the areas where the reviewers can make comments like, this is an excellent application, or the applicant forgot to submit the data from their most recent needs assessment. They described the methodology, but they forgot to submit the data. Can you please log back in and submit the data? Once the reviewers complete all the checklists and they've submitted the completed list of their checklist and their comments, we gather their comments and then we share the feedback with the applicant. So it's really important that the applicant get to see what the feedback from the reviewer committee was and is. And so those folks then have the opportunity to respond to that. Like, you forgot to submit the data from your needs assessment. Could you please log back into your application and submit that one one document that you forgot. And then that gives you a chance, the applicant, the chance to complete anything that was missing, or to add some specificity or clarity to the narrative of the application. And then once the reviewers get a chance to see the feedback, they can then make a final determination whether to approve the application or not. Here is a screen capture of part of an application. So here's the description. The top part is the narrative from the applicant about how they manage their post-test process, and how they write test questions. And the drop-down menu up here gives the reviewer a chance to download the post-test, to review it, to make sure that it meets all of our standards. They come in and they complete the checklist they want to, and they fill out their comments in the box, and then they hit next, and they go to the next section of the application. So again, every section is separate and unique and individualized, and the reviewers get a chance to go in, review every section, make the comments, and then move forward with the rest of the application. So typically, right now, if your application is complete and all the information is there, all the documents are there for us to review, the typical review interval takes about 4 weeks. Now, years ago, when we first started the review process, applicants were required to gather all their documents in a big binder and send 4 copies of all the documents in 4 separate binders to the CAPCE office. And we would keep one for us, and we would send the documents out to 3 individuals who would then review the documents and fill out the checklist and mail it all back. And that process took anywhere from 12 to 16 weeks. Now that we manage the process electronically through the website, the review interval is dramatically reduced. 4 weeks is actually generous. We're getting a lot of applications in within 2 and 3 weeks once they're submitted by the applicant. If there are missing items, if there are things that you forgot to submit, or pieces of it that the reviewers want, again, a little more clarity or a little more specificity, those typically take 6 to 8 weeks. But that interval, again, is drastically reduced from the months that it used to take us. As an added advantage to the applicants in the, I believe it's Appendix H or J of the application manual, there's a checklist of the documents that you need to apply for organizational accreditation. And so we recommend that you read through the manual, look at the checklist, and gather all the documents that you need in a single folder or on a flash drive. And as you go through the application process, you immediately have access to the documents that you need that support your application. You can upload those directly. So once the application process is approved, and we look at the documentation, and the documentation is approved, the applicant has provisional accreditation for up to 12 months. And then within that 12 months, we administer a site visit. And so the site visit really is designed to determine what parts of the application match with the practices of the site. And are they doing all the things in reality that they said they're doing in the application? And so as we go through the site visit process, we go through an entire day. It usually takes 8 to 9 hours to go through the site visit process. Then the 2 site visitors meet in the evening after the site visit. They make a list of observations, recommendations, and requirements. And the next morning, they meet again with the applicant, and they say, here are our observations, recommendations, requirements. And one of 3 outcomes happen. Either you're accredited without any contingencies, you're accredited with recommendations for change, or you have continued provisional status until any deficiencies that were identified are then corrected. And once you correct the deficiencies, then we move you from provisional status to accreditation without contingencies. And so some of the services that we've added since going through the electronic accreditation process include the ability to do real-time reporting. And so we've spent a lot of time developing a software package that allows the accredited providers server and website to download course completion data directly to our website into our database without having to gather the data or input it, have a person sit at a desk and type the information into the website. It's all managed through an API, and it's very seamless, and it doesn't require a person to sit there and have to manage the data. It all happens. We added the web-based application process. We've added the online accreditation manual that we've talked about multiple times here today. That manual, again, is in the process of being updated. The new manual should be past the copy editors and past the translation service by the end of this year. And we're working very hard to have it ready by January 1st of 2025. We've also added a mass course creation system. And say, for example, when NAEMSE wants to hold their next symposium meeting, rather than having to go through and create all the course numbers manually, one course at a time, they send us a spreadsheet that lists the dates, the times, and the course titles. And we take that spreadsheet, we put it into our system, and within a few seconds, it kicks back all of the course numbers and all the number of hours, advanced versus basic, educator, management, and so on, all contained in that one spreadsheet. So that process saves the accredited provider that's doing a large event significant time. And the last most exciting thing is we've added an application through a mobile device that allows the user to scan a QR code at the end of the session. And we're pretty sure that NAEMSE is going to roll this out at their symposium in 2025. So we look forward to helping them with that. And so the user, say you've gone to a session and it's a live session, or this session, potentially an F3 session online. And the last thing you see after the lecture is completed is a QR code. You open the CAPCE app, you scan the QR code, and then that app marries your license data in the mobile app with the course data in the QR code and sends it to the CAPCE database. That process of sending the data to the database takes about 7/10 of a second. So it's a really efficient, quick way for you to get credit for course completions immediately after the course has been completed. And so it's kind of up to the the accredited provider to institute the QR code process, but we're working with our providers, and currently 97% of the course completion records that we're getting come in real time. That's a pretty exciting thing for us. And we've updated the data sharing process. So if you're nationally registered, and if you've ever gone to the National Registry website and used that Import CAPCE Courses button, you click the button, and any course that you've done that's accredited by us, that's been reported to the website, it moves over to your file within the National Registry. And then you in the past would have to go through and assign those courses either to your national, your state, or your local component. Last week, actually, as of October 1st, so a little bit more than a week ago now, we added the course topic to that data set. And the National Registry spent a fair amount of time and programming energy to program their system to receive the courses with the course topic, such that the course automatically fills your recertification process, starting with the national component and then moving down to state and local. So any extra hours you have automatically fill your recertification profile, then you honestly don't need to assign anything anymore. And so this is just a service that CAPCE added because we thought it would be helpful to both accredited education providers, but EMS clinicians, to help to make the recertification process that much more efficient. And I promised you at the end sufficient time for questions and answers. So that's the end of my comments, and we're happy to answer any questions that you have now. And I'm assuming that this is going to be moderated. So you're going to provide the questions for us?
Yes, absolutely, Jay. So we
Excellent.
have a question here from John. I requested the key and paid the fee approximately 2 years ago, but I haven't completed the application. Is there an expiration time to complete the application process? I hope I don't have to start over.
Yeah, actually, there is an expiration time and it's 12 months. So if you haven't done anything with your application in the last year, or if it's been more than a year, we're going to ask you to start the process a second time. But that's starting the process. And if you have questions about the fees, if you paid the application fee, um, I would be willing to discuss that with you, waiving the application fee so you can restart the process again.
Perfect. And then we have two questions from Alex. The first question is, as I am new to the CAPCE reporting process, my question is, when applying for approval for a live course, when submitting the course using PowerPoint slides, how many slides are the minimum to meet an hour of CEH?
Yeah, that's a good question. That's dependent on a couple different things. First, there should be content related to the objectives. We want to see at least 3 post-test questions for every objective listed in the in in the course. So really, if you're going to create, say that you're going to do a 15-minute program, and that's going to be followed with a 10-question test, you get credit for 1 minute for every test question. And so you can kind of gauge, 15 minutes of content plus a 10-question post-test should get you an hour's worth of continuing education time, as long as those objectives and the content and the post-test align, like Mr. Wales talked about in the curriculum matching.
Yeah, I'll just add that there's not necessarily a minimum number of slides, because you may have one slide in a live presentation and have 50 minutes of excellent discussion around it. As long as you have submitted in that course paperwork some documentation of what that conversation is going to look like, what that discussion is, what are your obviously learning objectives, and how are you going to accomplish those learning objectives, especially if you're kind of light on published content. We do have some guidance. There are educational activities where you can assign someone a reading project only, and there's some guidance around how many words you should anticipate them to read for an hour's worth of CEH. I think 1 hour is around 8,000 words, assuming you also have a post-test after that as well.
Thank you. And Alex's next question is, when applying for approval for a live course and you have clinical live skills to be performed to be included for CEH, how do I report that within the application and for it to be approved for CEH?
Yeah, so one of the first sections of the application, we ask you to describe within the narrative box the makeup and the structure of the educational program. So if you describe it there, within that process, then the reviewers get to see the makeup, and then they would better understand the way you've designed the course. For example, when the pandemic came and we found out there was an awful lot of things we used to do live, now we have to do online, and we built a fair amount of hybrid courses around that. CAPCE is pretty used to that, as long as you describe it well within the narrative section of the application.
And we have a question from Melissa. This has been very helpful. Have you had non-EMS service hospitals successfully apply for accreditation? We have integrated paramedics into our EDs and are working on creating an in-house education program for them.
The answer to that question is yes, we have. We've had a few, actually. There was one large organization in New Jersey called Monarch that was accredited by us for a while, and then things kind of went sideways for them, and they kind of backed out from the organizational accreditation. But I think currently we have 3 or 4 hospital organizations that have applied for accreditation, so they can provide CE directly to their staff.
Yeah, and I think if there's any critique that we get about our standards, it's that sometimes people say they're very general and not prescriptive enough. And that's very intentional on our part, because we have EMS services that are accredited, we have online educational services that are accredited, and we have hospitals that are accredited, as well as other organizations, in the med device industry or in fire industry that are accredited. So we write the requirements broadly to try to encompass all of those different models of education so that as you are trying to create an in-house education program for paramedics in your emergency department, that you have the flexibility to be able to do that as long as your process meets the rigor that we require.
Janice asks, what is the fee to submit an application for a single course?
Um, Actually, it depends on the length of the course, but an individual course is $165 per credit hour.
All right. If anybody has any other questions, please feel free to submit those in the chat or the Q&A panel. Um, for now, it looks like that is all of the questions that we have.
While we're waiting, if anybody else has another question, I'll just say that we do occasionally do workshops to help people through their applications. And Jay is also working on having the staff set up some sort of office hours where there will just be a set time where people can call in with any questions you have about your specific application and your specific situation. So if you would like to talk to somebody, just reach out to Jay or Maria at the office and they can get you answers and or let you know when the next workshop will be or the next office hours will be that someone will be available to work with you on your specific questions.
All right, I have a couple more questions here. Melissa asks, we have a nursing professional development organization and a medical education department connected to Chamberlain University. Would you recommend us connecting this with medical education over NPD?
I think that's a pretty detailed question, honestly, and we've worked hard with the nursing and physician professions to try and get recognition of CAPCE accredited coursework for nursing and physician continuing education. And I hope I'm answering this question right. If I haven't, please let me know. But there really isn't a crosswalk right now for a link between EMS CE with nursing and physician CE. The individual is allowed to apply for recognition of continuing education hours to both the nursing and the physician groups that manage continuing education, but there isn't an automated pre-recognized process for those groups. So even for those individuals that are cross-trained, some docs that I know are still practicing paramedics, and of course there are nurses that are cross-trained as flight nurses and field medics, and unfortunately there really isn't an automatic direct tie-in. And so I think that's the nature of the question. If I've not answered it correctly, let me know.
And John asks, I perform a 2-day, 20-hour on-site class many times nationwide. Can I make an application for this? And do you have an estimate on how much it would be?
You can, that would be part of a combined application, and we would call that probably a one-time live event with repeating content. And those applications are $25 per credit hour, maxed out at $2,000.
Okay, it looks like that is the end of our questions.
All right, well, thank you very much for having us, and we appreciate having this opportunity to talk with everyone here today.
Absolutely. And thank you so much, Jay and Robert, for being here with us today. Your knowledge is so appreciated. I know that at NEMSI, we are so thankful for our partnership with CAPCE, for our accredited organization, and we look forward to many more successful years with that. Everybody, I will send out a follow-up email with more resources on how you can get in touch with CAPCE, as well as the link to today's recording and how to obtain CE. So with that, I hope everybody has a fantastic rest of your afternoon, and we will talk to everybody next time. Thank you.
And stay safe, everybody.